Assembly of a working Sonicision curved jaw cordless ultrasonic dissection device requires a single-use dissector, a reusable generator, a reusable battery pack, and a reusable battery insertion guide. To begin, transfer the dissector, battery insertion guides, and generator aseptically into the sterile field. Slide the generator into the opening until it makes contact with the dissector. Hold the dissector shaft rotation wheel, then turn the torque knob clockwise until it clicks twice. Note that you must attach the generator to the dissector prior to inserting the battery pack. Hold the handle with the open battery compartment up. Seat the sterile battery insertion guide onto the open dissector handle and hold firmly. Orient the battery pack with the battery insertion guide, then insert the battery pack through the battery insertion guide into the dissector handle. After the battery pack is seated in the dissector handle, remove the contaminated battery insertion guide from the sterile field. A series of audible tones and an illuminated green LED on the generator indicate correct assembly. Do not touch the battery pack. Close the battery compartment door from the outside until there is tactile feedback and an audible click. In order to ensure the device meets required essential performance, it should be tested after assembly and each battery exchange as follows. With the clamping jaws open, test the minimum power mode and maximum power mode. If the device generates different pulsating tones for each power mode and a green LED is present, assembly is complete and the device is ready for use. If inaudible or undifferentiated tones or a non-green LED are present, you will need to troubleshoot. The dual mode energy button activates the ultrasonic power to the active blade. 2 power settings are available. In minimum power mode, the energy button is depressed to the first position. A low-pitched, slow pulsating tone indicates minimum power activation, and slower dissection is produced when increased hemostasis is needed. In maximum power mode, the energy button is fully depressed. A high-pitched, fast pulsating tone indicates maximum power activation, and faster dissection is produced. Place vessels and tissue in the center of the jaws to assure optimal hemostatic effect. Do not place tissue in the jaw hinge. Examine the vessel for complete hemostasis. If hemostasis is not achieved, use appropriate techniques to maintain hemostasis. Failure to inspect the vessel may cause serious injury to the patient. During energy activation, ensure that the jaw lever is pulled back completely to the device handle and jaws are fully closed to ensure optimal dissection of tissue. Not fully depressing the jaw lever may result in extended activation times. Do not release the dual mode energy button until tissue is completely coagulated and/or divided. Contact between the active blade and other metal objects, hemostats, clips, staples, retractors, etc., may result in product damage, such as a broken blade. Pieces of a broken blade may fall into the surgical cavity, causing unintended tissue damage. Do not activate the instrument with the clamping jaw closed unless tissue is present. This could damage the device jaws and cause injury to the patient. Keep the jaws clean during use. Buildup of eschar and tissue may reduce the effectiveness of the dissection and coagulation functions and cause abnormally high temperatures at the distal end of the device. During the procedure, carefully wipe the clamping jaw and active blade with wet gauze, or submerge the distal end in a sterile saline bath and activate with the clamping jaw open as needed.